It can cause reduced growth of the baby in pregnancy. So these are some of the things that fibroid can cause. So finally, I will quickly talk about some general things that women should do to check themselves regularly. Some particular investigation that is peculiar to women, which will help them. So, where women visits, annual visits with healthcare provider to discuss health, perform physical examination, and provide guidance on preventive care. Yes, this is important. Take time out at least once in a year to see a doctor. If you're a female, to see a gynecologist, even though there is nothing wrong with you, just do a general checkup, run some investigation, do some breast check. Okay, of course, that will be done by general surgeon, but some investigation on breast. If you are age of 40 years and above, you should do what we call mammography. I'll still get there. So these are things we expect you to do at least once in a year. Take your time out to see a doctor and do all these things. Then there is something we call pap smear test. It's a screening test to check the mouth of the womb that we call cervix, to check for changes in that place that can result to cancer of the cervix later. Now that problem is being caused largely by human papillomavirus. We call it HPV. So if you do pap smear testing, we'll be able to detect early that, oh, there are some changes in that place. Then we'll do some other investigation to see if the person can have cervical cancer in the nearest future, and we'll be able to know how to prevent, give appropriate treatment to prevent that cancer, from coming way ahead of time. So that's the privilege of doing pap smear testing. So regular pap smear screening for cervical cancer, typically every 3 years. Yes, we do that every 3 years. Then pelvic examination, annual pelvic examination to check for abnormalities in the reproductive organs is also important. Then, yes, I mentioned mammogram. So this is part of cancer screening. Every woman at 40 years and above should do mammogram. Okay, this is to rule out tendency for breast cancer. Breast cancer is one of the top leading causes of cancer death. So it's important. Endeavor to do breast examination for yourself, clinical breast examination, annual clinical breast exam by healthcare provider. That one is once a year, and you can do your breast examination regularly. There was a patient that I saw recently also. She's a pregnant woman, and she had breast lump. We are working with the general surgeon to, take care of that for her. But how did she get to know that? The thing was still small, but because of our breast examination, she was able to pick that early. So then colorectal cancer screening, starting at the age of 50, screening for colorectal cancer using colonoscopy and all that. I think people that have family history, say for example, a brother in the family die of colorectal cancer, then see your doctor from age of 50 to do endoscopy to rule out possibility or any changes that can result to that. So then reproductive health care, birth control. This is important. Discussing birth control options, meaning family planning with your healthcare provider to prevent unintended pregnancy. Yes, some people, I wouldn't say careless, but endeavor to protect yourself. Yes, it's you are in the institution of marriage where it's a legal right, but when you are not adequately putting things to help you in place, it can result to pregnancy that you don't want, and that can put a lot of stress, psychological stress and all that. That's when a Christian will be tempted on abortion and whether we should. Don't even let that rear its face. Do contraception, family planning ahead of time to prevent till when you are ready. So I think that's important. Sexually transmitted infection, regular testing for sexually transmitted infection, especially chlamydia and gonorrhea. These are very, very terrible sexually transmitted infection that can damage both the tubes and also the man, I mean the urethra for a man. So these are things that are, I mean, this actually would be for people that are promiscuous, as in people that have many partners and all that. But if you don't have any symptoms of that, it's not a worry. Then HPV vaccine, yes, this is for women who are virgin, who have not met with a man before. They can take the HPV vaccine. Otherwise, children, I mean, pre-adolescents, adolescent children can, I mean, who have not been exposed sexually can take the HPV vaccine. So I think having said that, okay, I'm getting to the end of the presentation now. Bone health, bone density test. Yes, women at the age of postmenopausal women, people at the age of 65 and all that, because they are not having the hormone, the estrogen hormone again, it has a kind of bad effect on their bone. So a condition called osteoporosis, which is a condition that weakens the bones, can predispose women of this age group to fracture. Bone breaking and all that. So it's important for them to do bone density tests. Then also calcium and vitamin D supplement is important, especially women that have stopped menses, menopausal women or postmenopausal women. Calcium and vitamin D supplements can be of help to maintain the health of your bone. Then mental health, depression screening, regular screening for depression and anxiety, mental health support, seeking support from mental health professionals if needed, especially people that are being troubled right, left, and center, and is almost becoming like you are psychologically not stable and things like that. It won't be bad for you to, with the help of your pastor, okay, to see a mental health doctor. Yeah, it may look somehow to say psychiatrist, but that's the truth. Sometimes when things are getting out of hand and it's as if the mental challenge is becoming too much, you are not thinking straight again. Yes, you may need to call for help to see a mental health doctor. Then other things, blood pressure check, cholesterol screening, BMI check, dental care, very important, regular dental checkup and cleaning to maintain oral health. I think by and large, this is what I have. Then finally, let me quickly check time and see. Okay. Finally, I would like to quickly say something to strike balance between issue of faith and health. From what I've seen many Christians make a mockery of our Christianity by coming to the hospital to say that I don't believe in this, I don't believe, and yet the faith they are claiming, they don't know the head and tail of it, and they bring themselves to to terrible problems that eventually take them out before their time. So, okay, what happened is this: there is a balance between health and faith. The institution of health or medicine was constituted by God or was provided by God. Let me put it that way: was provided by God, and I, for one, it's a privilege for me to be a doctor, and I would say it's a complete guidance of God to be a doctor today. And I've come to know that, first of all, if you have any complaint about your health, see a doctor. Let a doctor tell you this is what is wrong. When you now know what is wrong, then you now know how to handle it. But for you to see something happening to you and you are ignoring it, it's a careless and reckless way of life. If you are on the express and you are hearing your tire you can see that your tire has, flung out, and you are driving with rim, and the thing is making noise. The next thing is, God forbid, accidents. So when you are seeing warning sign in your health, don't ignore it. Approach your doctor. Doctor, this is what I'm battling with. Then let them investigate and tell you what it is. When they now tell you what it is, then the next thing is, how do we handle it? By faith and by medicine. Yes, personally, there are times I get stressed so much and I see symptoms of malaria, and I tell myself, which way am I going? Do I want to stand against it by faith, or do I? When I know that I am not in good standing, not insane, no, I'm not insane, but I know that, like, the whatever it is, the malaria has so much, like, it has gained ground, and it's as if I get into that battle, I'll just be, what does it cost me? I just get anti-malaria and uh, take and get myself to be fine. Pray over it, take my medication, and I'm fine. But there are other times that I know that I stress myself, and I tell myself, okay, don't let these other things set in. Just take time to rest now. And I take my confession serious at that time and prevent the whatever symptoms I want to rear its head. I might have been seeing some small things, but when it's far ahead like that, I just take my time and take my scripture very well and declare and make sure that it doesn't come. Then I take time to rest also. Personally, that's the way I fight. Now, when you learn this, it may not be a day thing, but the primary thing I'm saying now is, if you have any complaint, first see a doctor, inform pastor about it. Sir, this is what I'm dealing with, and by the time you see a doctor, whatever doctor tell you, pastor, based on the training that God has helped pastor through, he will be able to guide appropriately. So I think with that, we'll be able to reduce making a mockery of Christianity, especially with people of other faiths out there who are looking at, why are these people like this and things like that. I've seen many people succumb to the cold hand of death, by that careless method. Faith, they are not doing. Medicine, they don't want to agree. They are just, so I think by and large, I would like to pause there to entertain question. If there is any other thing that come, I'll say it. Sir, I think I will want to entertain question now.
Thank you so much, and the Lord bless you. Thank you for the
Amen.
teaching. The Lord will continue to increase you more and more in Jesus' name.
Amen.
Now, this is time for questions. Though I do not receive anybody sending any questions to me, but if you have any questions out there, you can quickly unmute your speaker and be brief about your question. Quickly.
Good morning, sir. Good morning, Pastor. Good morning,
Good
Dr.
morning.
Sokunbi.
Yeah.
Thank
Good
you for
morning,
being a
ma'am.
blessing. God
Thank
bless
you.
you, sir. I have a
Amen.
bunch of questions here, but I will try to be brief
Okay.
in order to give other people chance. My number one question, sir, is apart from hormonal imbalance, what are the other things that can cause inflamed thyroid? So do you want me to stop there, or I should be just mention other questions?
Inflame what?
Inflamed thyroid.
Thyroid. Okay.
Thyroid, yes, sir.
Okay.
So that is number one question. I have like 3 or 4 questions. Do you want me
Okay.
to do you want to answer
Go
it all
ahead and
together?
ask the second
Yes. Go
question now.
ahead. Go ahead. Go ahead, ma'am.
Okay, sir. The second question is it like advisable to operate a fibroid? And at what stage? That is question two. And the next one is that uh, this medication, I mean, for those that are already in menopausal period, is progesterone, is it really advisable to be taking it? Or if when the doctor prescribe it, or is there any particular reason why is it being prescribed?
Okay, ma'am. Okay. Is that all, ma'am?
Not all, sir, but let me leave it that.
If you have more, you can quickly ask. I'm jotting them down. So
Okay, sir. The pap smear test, is it really
okay.
advisable for those that are, I mean, for the younger, the younger adults, I mean, from age like 18 to 30 or 18 to 25. Let me be brief like that.
Okay. Good. Let me. Okay. Can I answer now, or you still have more?
I
No,
think
it's
that's
okay.
okay.
Yeah, that's okay, sir.
Okay.
All right. So let me start with the pap smear. Pap smear test is done for women that are sexually active. It's primarily being caused by what we call human papillomavirus, HPV. So, and that is being contacted through sexual intercourse. So, if a woman has not, even if she's 50 years and she has not met with a man before, she's not likely going to have cervical cancer. She cannot have it. We call them none. So, but if a lady is age of 18 and she has been having sexual intercourse from age of whatever, she's a candidate to do pap smear. So that's if she's 18, she's 25, and she has not had any sexual exposure, there is no need for any pap smear screening. But if she's sexually active, no matter the age, she's a candidate to do pap smear testing. So then, number two, you mentioned thyroid, causes of thyroid enlargement. You said, is it hormonal imbalance? Okay. There are some hormones in the body. When they are low, the organ is trying to produce, is working hard to compensate for that low. If you remember when I was talking about anemia, somebody having heavy menstrual bleeding and shortage of blood. Now the heart is overworking itself to pump more blood. I mean, to pump the small blood like normal amounts. Now, as a result, it's pumping, is overworking itself. Okay. Now, when it comes to the thyroid gland is in the neck, is what we call goiter when it's enlarged, goiter. Now, when there is shortage of the hormone that is meant to be produced, so that I can, I mean, the certain hormones, so that I can produce the thyroid hormone. So when those elements that are needed for it to produce as much as it's supposed to produce are short, it's going to overwork itself. As a result, it becomes enlarged, and that is causing. So one of the things we do is to give drugs that will help to produce what is needed, so that the one that is short in the body uh, is being supplemented. Also, it can also be due to what we call an autoimmune disease. There is something we call autoimmune disease with thyroid enlargement. It's not only when there is shortage of something. Autoimmune means that some cells of the body are fighting themselves. Some cells are produced and some cells, so like the body cell is attacking, is producing cell that is attacking itself. That's how that condition is. So that also, but it's a bad condition. So, but if somebody has just thyroid enlargement and with medication is resolving, it's fine. But there are times that it may be necessary to operate it, and that's under the jurisdiction of a general surgeon. They may need to operate it for the person to be fine. So then you ask that, is it advisable to operate fibroid? Yes. If fibroid is disturbing you, yes, you need to operate it. If it's not disturbing you and it's just swollen there and you are age of 55 or thereabout and it's not causing any problem, you can leave it since it's not. By the time you get to, in fact, around age of 45 to 55, that's the age of menopause. Averagely is around the age of 51 that majority of people, get to menopause. But if you're around 50 something and fibroid is there and is not disturbing you, you may not bother yourself, since the estrogen is going to and progesterone is going down, you know, around that time. Then is progesterone as advisable for fibroid? We don't give progesterone for fibroid. It's not a drug we give for fibroid. It's not to treat fibroid. We don't give it. So I think that's that. Then people do a lot of things. So people may tell you that do this, do that, and all that. People just come up with different idea, different things here and there. But it's not. We don't give that kind of medication. Yes, there is something we give. We give tranexamic acid. It's something we call antifibrinolytic agent. It helps to reduce the bleeding when the woman is having heavy menstrual bleeding. It helps to reduce the amount of bleeding. So we may do some symptomatic treatment for fibroid, but not like we want to give something to solve the problem completely. It's usually, if it's not disturbing you, it's fine. If it's disturbing you, we treat according to how it's disturbing you. Then if it's necessary, we take it out. I hope I've answered your question.
Loma, I hope all your questions have been answered.
Yes, sir.
Okay.
Thank you, sir. Thank you,
Yeah.
Dr. Bless you,
Thank
sir.
you.
Okay, let's
Thank you.
welcome more questions from more people. But if there's no any other question, then I will allow you, Mrs. Alaba, to ask more of your questions. Is there any other one? Yeah, go ahead, Tosin. Are you trying to ask a question?
Yes, sir. Good morning, sir.
Question.
Oh,
Good morning, ma'am.
Yes, sir. Thank you, sir. Thank you for the teaching. It's so educating, sir. Sir, my question
And I
is,
hope it's not too much.